Taking care of people at the most vulnerable is the most fulfilling and overwhelming experience.
It's a vocation and a real commitment.
It means so much to them at that point in time to know that they are well looked after, no matter what.
For me, the most essential skill that a nurse has is the ability to care. Empathy is one of the core values of being a nurse. When you look after someone, you need to understand how they feel about being ill. What do they want out of their care?
Going into nursing was a life-changing experience for me, and when I get back from a day of placement and I really feel like I've made someone better, that just gives me so much joy.
We are quite privileged here at the University of Hertfordshire because we have a good experience in terms of theory and practice.
Resilience is very important in nursing because you have to deal with a lot on a daily basis. The motivation and determination to continue learning and to continue practicing at my best comes from when you suddenly realise that you have people's lives in your hands. It's sometimes tough being a nurse and not always easy.
I feel so proud and equipped with the skills I need.
I'm confident now that I can make a positive impact.
Because I made the right choice studying at the University of Hertfordshire. There is no better place to create your story.
Welcome to the Ambulance Suite at the University of Northampton. This is where we do most of our practical scenarios when we're training you to be a paramedic, and we've got lots of fancy equipment for you to explore. One of our main pieces of equipment we use is this, which is actually an iPad, but it's designed to simulate anything that we want to replicate for a monitor that you'd use out in ambulance practice. And what's really good is if they update the software for this, or you use different monitors out on the road, then actually we can mimic that out on the road as well. And it's exactly the same as the equipment you'll use when you're out on ambulance placement. So for example, if we wanted to do a blood pressure, you can press the blood pressure button, makes the noise and actually pumps up and will display in a short amount of time. I'll just stop that because it's quite loud, it sounds like an aeroplane going over. The other thing that it can do is actually print off 12 lead ECGs, which helps tell us whether you're having a heart attack or not. So you select the age and the sex, and then it will print out like a real ECG would, and we train you how to interpret these so you can tell whether patients are having a heart attack or not, which is really good from a lifelike point of view. You'll notice we're in the back of the ambulance as well, and what we tend to do is actually enclose students in here. We've got the real life monitor here, we've got cameras up here, and it will be as close as you can get to being in the back of the ambulance when you're out on placement. And we feed in all the inputs through either an iPad, which will replicate any observations we want on the screen there, or we can control our lifelike mannequin through this bit here. So we'll go and have a look at our mannequins and how it replicates real life. So I appreciate they don't look very real and they look a little bit scary if you look at them in the eyes, but what the bonus of these mannequins are is you'll see that it's actually breathing there. So in the past, simulation used to be where you'd walk in and a tutor would have to tell you what they're finding. Now you will come into the back of the ambulance, we won't have any input because we're out the back watching the monitors, and then you will assess, is the patient breathing? And you can see there, if you see my hand moving, you can see that patient's breathing absolutely fine. You can check to see if it's got a pulse in its wrist, a pulse in its neck. Also we can check the airway, so there's things where we can swell the airway up to look like it's an allergic reaction. You can make the mannequin scream if you do anything that causes them pain at all. You can make them cough. We can replicate lung sounds. So effectively you're going to come into this environment and assess and treat as you find without any inputs from the tutors at all. And the overall aim is that we make this as real and replicated practice as much as possible, really.
I was drawn to physiotherapy because ever since I could remember, I've always wanted to help people. The practical side of this course is really great because it allows me to gain a real in-depth insight into my future career as a physiotherapist. The human body is an amazing system of complex biophysical and biochemical interactions. There is so much to learn. This is an intensive course, but fortunately we have great facilities here and the lecturers are really friendly and hands-on. This means we learn by doing and problem solving, and then putting our knowledge and skills into practice during our placements. We can even complete Level 2 and Level 3 Register of Exercise Professionals qualification here as we learn. I like the fact that I am able to be challenged and no day is the same. I plan to continue my story at the University of Hertfordshire by just taking on all the skills that I've learnt throughout the 3 years. I just hope to be the best physio that I can be, and my goal is to assist people in getting back as much of their function as possible. And I just hope to go from strength to strength.
Hello and welcome. My name is Jane Campion. I'm the Programme Leader for the OT Apprenticeship Route, and I lead on the skills modules in the Level 4.
And hello, my name is Jenny Devers. I'm the Programme Leader for the full-time programme route in the BSc. And at the University of Northampton, our top priorities are to give students valid and realistic learning opportunities in a safe environment. We have access to purpose-built skills rooms where we can create realistic scenarios for students to develop their knowledge and specialist skills in occupational therapy. We can simulate experiences that clients might have when they have got disabilities or impairments when they're carrying out everyday activities to increase our understanding of the difficulties that they may encounter.
So within our bathroom area we have various equipment. So we have bath lifts, bath chairs, bath seats, and it's all about trying to look for sort of the minimal amount of equipment that a client would need. But still be safe to be able to get in and out of the bath. So students get an opportunity to practice these, see how it feels to use equipment and adaptations. We also have a range of wheelchairs and walking frames in here. Again, for to try, you can take them out around campus. So you experience what it feels like to use the equipment that you would be recommended to your clients. We also have again a coaching stool type arrangement, so again for washing and dressing, adaptive toilets and adaptive shower areas, because it's really important that the clients feel that whatever equipment is provided for them, that they're happy with it and that it's safe to use. So it's important that you can experience it as a student whilst you're with us on the course.
So this is our skills bedroom, again where we are giving students an opportunity to practice teaching their clients and also feeling what it is like to be a client in carrying out those everyday activities, whether it's getting in and out of a bed, up and down from a chair, and using the hoist. So we'll have small group sessions working with the students where they can try out using these equipment and again experience what it's like to be a patient and also to be a student practitioner.
So part of the experience of using this room is not just using the bigger equipment like the hoist and the rotundas, it's also about using dressing aids and smaller equipment. Because again, it's very easy as a therapist to give out equipment to your clients, but it's always important that as a student you've used it to feel like how it is to use and how effective it is to use, because some of this equipment can work for one client but not for another. Within here as well, we will look at things like personal care. We will look at teaching students things around dignity, compassion, working with somebody who is in a bed situation, so that it's really important they can get those communication skills right.
So this is our skills therapy kitchen where students can experience what it's like to work with clients. And we've got this specialist equipment that the students can learn to operate, and these would be potentially some things that they would prescribe for clients who have permanent conditions. So we've got our adjustable work surfaces, and a client can be in a perching in a medium height level, but potentially if my client needed to develop her standing stamina, I could raise this, obviously not in situ, and she could operate in a standing position. So alternatively, we might have a wheelchair-bound client who has to work from a seated position. So again, we've got this equipment where the student can sit, experience what it's like to be a patient and to work at a seating level.
So each OT student who joins us will have a uniform for practice placement. and it consists of a tunic and green trousers. That's really important. That helps an OT student start with their identity on their journey as a professional OT.
We will support you learning and developing your skills to become more confident as practitioners when you go on placement and in your future careers. We really hope you join us at the University of Northampton.
Hello, my name is Vicky Morris and I am a lecturer in tourism management at the University of Bedfordshire. So I'm going to talk to you today a bit about the diversity that we offer within the tourism and events department. So firstly, I'm going to talk to you about the diversity in the courses that we offer. So we offer tourism, we offer hospitality management, we offer events management, and we also offer travel and aviation. You could do these singly or you could do these in combination, offering you a wide range of choices of the different things that you could do. We also offer a lot of diversity in the career opportunities that you could have at the end of your course. We have students that come to us who sometimes don't quite know what they want to do when they finish, which is quite natural. Why would you know yet? But these subject areas offer you a wide range of opportunities and a wide range of career options. We have students that come to us with a very fixed idea of exactly what they want to do. But after completing the course and seeing all the different opportunities available, they quite often change their mind and do something completely different. They may come in wanting to work for a cruise company and end up going to be a hotel manager. You'll also learn a wide range of skills as part of your course. You'll learn communication skills, presentation skills, IT skills. You'll learn to work with other people, and these can all be used in many different aspects and different careers. So if you do get to the end of your course and you're absolutely sick of your subject area, it doesn't really matter because you're still keeping your options open and you're still keeping your career opportunities available. We also give you a wide diversity in the way we teach you, as well as the traditional lectures and seminars that everybody will do. We offer a range of field trips where applicable. One of the firm favourites is a trip to Disneyland Paris. It's not all Mickey Mouse and fun and games and rides. We do have to do a bit of work there as well. It is an educational trip after all. And you'll get to do things like meeting the marketing managers and learning how they do their marketing plans and put together the marketing for Disneyland Paris. We'll also do trips to places like Duxford, Luton Airport, Stansted Airport, as well as Luton Hoo. All linking in with the different concepts that you're going to be learning throughout your course. We also try to give you more industry knowledge by bringing in guest speakers. We've had various different people come in from TUI, Visit Finland, events management companies, and they really can tell you exactly what is happening out in the industry today. They can give you up-to-date current knowledge, and it helps to put in perspective everything that you've been learning in the classroom. We also do some event planning for our event students, and they get to first-hand put their own events together, so they can put all the skills they've been learning into practice. Lastly, we give you quite a lot of diversity in the topic areas we teach you. Tourism isn't all about booking holidays and travelling around the world. There's a lot more to it than that, and you'd be surprised at the different things that we study. With all our subject areas, we look at things like culture and society and how they affect them. We look at heritage and how that's linked to what we do. We might look at destination development and management aspects so that you're able to go out and do those skills for yourselves. And a key theme in the world now, we'll look at sustainability. And with all our other subject areas, with events and hospitality, we'll look at current issues, as well as giving you a great grounding and background in the subject areas that you've chosen to study. So overall, there's a wide diversity in this course area. If you're not quite sure what you want to do, or if you've got a fixed idea of exactly where you want to go, I'm sure we'll be able to hone your skills and develop you the way you want to be.